Everybody worries about heart disease and cancer, and they should. They are the two leading causes of death in the world today. But who thinks about kidney disease? In the world of detoxes, everyone has heard of colon cleansing, and many have even heard of liver cleansing. But how many ever think about kidney flushing? Again, perhaps they should. In the next few minutes, we're going to discuss why it's important and how you do it. 28 million Americans have kidney disease, and stunningly, most of those who have it don't even know it. But that's just the nose of the camel inside the tent. What do I mean by that? According to the National Kidney Foundation, 1 in 3 American adults is currently at risk of developing kidney disease. More than 661,000 Americans currently have kidney failure. Of these, 468,000 individuals are on dialysis, and approximately 193,000 live with a functioning kidney transplant. Bottom line is that close to 50,000 people die every year from kidney disease. And that's just kidney disease. Add in the fact that more than 50% of all women will end up getting a urinary tract infection, and we're starting to reach numbers that should cause people to sit up and take notice. Fortunately, there's a kidney flush program based on an herbal formula that can mitigate and in many cases even resolve most of these issues. The formula has 17 ingredients. Talking about each ingredient individually and the 50-plus studies that support them would take far longer than we want to spend today. It would also get very confusing as many of the ingredients actually perform multiple functions. Instead, what I'd like to do, which I think will be a lot easier for you to understand, is to focus on those functions or benefits, and along the way, we'll also talk about which herbs perform which functions. With that in mind, the formula provides 6 major health benefits. They are: first and foremost, it functions as an anti-lithic. That is to say, it has the ability to break up and dissolve kidney stones. 2, it can also soften and break down gallstones. 3, it can alleviate pancreatitis by eliminating pancreatic stones, since pancreatic stones are essentially gallstones that have flowed out from the gallbladder and blocked the common bile duct at the point where it is shared by both the gallbladder and the pancreas. It can function as a diuretic. It can inhibit infection anywhere in the urinary tract, from the kidneys to the bladder. And finally, it can soothe tissue and reduce inflammation throughout the entire urinary tract. Now let's look at those 6 benefits in more detail. The anti-lithic ingredients found in the formula include the homeopathic ingredients Berberis vulgaris and Nux vomica. It also contains agrimony, chuncapiedra, dandelion, goldenrod, gravel root, horsetail herb, hydrangea root, parsley root, and uva ursi leaf. That's 11 ingredients devoted to breaking down kidney stones. Why so many? Don't they all do the same thing? And the answer is yes, but in different ways, which brings us to the principle of complementary redundancy. If they all work the same way, then it would be pointless. But since they all use different biochemicals that each break down stones in their own way, you end up with a formula that works better, faster, across more individuals and for more different types of stones than if you relied on just a higher dose of a single ingredient. As an example, let's look at the active component in just 3 of those ingredients. For gravel root, it's cistofolin and 3 benzofurans. For hydrangea root, it's hydrangean, and for parsley root, it's luteolin and apigenin. That's 3 different ingredients for breaking down kidney stones, each with entirely different active components for accomplishing that purpose. That's complementary redundancy. Which brings us to gallstones. Remember earlier we said that the second health benefit of this formula is it can help eliminate gallstones? Well, why worry about gallstones in a kidney flush formula? As it turns out, there are 2 reasons. 1, it's a free ride. Even though kidney stones and gallstones are not the same thing, the ability to break them down translates from one to the other. In other words, the same stone-breaking ingredients work on both. And 2, since many people do a kidney flush in preparation for a liver gallbladder flush, softening the gallstones before you force the body to expel them makes the process a whole lot less uncomfortable. Likewise, the third benefit, dealing with pancreatitis, is a freebie. While gallstones are not the only cause of pancreatitis, they can be caused by alcohol or certain medications, for example. They are the most common cause of pancreatitis. What happens is that gallstones that have flowed out from the gallbladder can, in some cases, end up lodging in and blocking the common bile duct at the point where it is shared by both the gallbladder and the pancreas. This stops pancreatic enzymes from traveling to the small intestine, where they help digest food, and instead force them back into the pancreas. The enzymes then begin to break down and irritate the cells of the pancreas, causing the inflammation associated with pancreatitis. So again, the same ingredients that work on kidney stones and gallstones can indirectly help relieve the symptoms of pancreatitis in many cases. The fourth benefit is that the formula functions as a diuretic. The ingredients that perform this function are Nux vomica, Chunkabeadra, cornsilk, dandelion leaf, goldenrod, gravel root, horsetail, hydrangea, juniper berry, parsley root, and uva ursi. The first thing you'll notice is that most of these ingredients were also found in our anti-lithic list, but when you think about it for a moment, that shouldn't be too surprising. If an ingredient is going to become renowned for its ability to get rid of stones, it's going to have to do more than just soften them. It's going to have to flush them from the body too. And although the primary function of a diuretic is to flush excess fluids from the body to encourage the kidneys to do what they're supposed to do and balance fluid levels in the body, the very act of increasing the flow of water through the kidneys is going to assist in the flushing of any softened stones from the body. Incidentally, goldenrod is technically not a diuretic. It's what is referred to as an aquaretic agent. That means that unlike diuretics that also tend to flush out electrolytes along with the water, goldenrod does not, which means it helps maintain proper electrolyte balance at the same time that it's flushing water through your kidneys. Now let's talk about the fifth benefit, inhibiting infection throughout the kidneys and the entire urinary tract. The ingredients we're looking at include cornsilk, D-limonene oil, dandelion, goldenrod, gravel root, horsetail, juniper berry, orange peel, peppermint leaf, and once again, uva ursi. Each and every one of these ingredients has demonstrated antibacterial properties. And finally, let's talk about the ingredients in the formula that soothe tissue and reduce inflammation throughout the entire urinary tract. These would be Berberis vulgaris, goldenrod, gravel root, marshmallow root, peppermint leaf, and our old friend uva ursi. Now, to be sure, there are other benefits found in these ingredients, but since even though those benefits are important, they're also a bit tangential to the formula's primary purpose, I won't list them individually, but we'll talk about them collectively. 4 of the ingredients are known to help with cystitis, 3 with an enlarged prostate, and 3 are known for their ability to help detox the kidneys and liver. Okay, so that covers what's in the formula and what the formula does. Now let's talk about how well it works and how fast it works. And at this point, I would like to tell you a story. We received a letter from the foundation in which someone wrote in to say that they were a big fan. They mentioned that they had turned their health around using the Baseline of Health program, so they were a believer. But they had a big problem where they found online where I mentioned that the kidney formula could begin producing results in less than an hour. And a quote from their letter, "John, you're too good to damage your reputation by making miracle claims that formulas can dissolve kidney stones in an hour. That just plays into the hands of the medical establishment that is looking for any reason to discredit the alternative health community." Okay, that was their letter. Now, I appreciate the good thoughts and kind wishes, but I stand by what I wrote. First, let me explain that I have never claimed that the formula could dissolve stones in less than an hour. Just that people could begin to feel results in reduction in pain and pressure in less than an hour. When you actually think about it for a moment, it makes perfect sense. If you drink a large glass of water, how long is it before you start feeling the need to pee it out? It literally takes less than an hour for liquids that you drink to make their way through your body and then out through your kidneys and into your bladder. The bladder then serves as a holding area until sufficient pressure builds up, telling you that you need to take a pee. But the simple fact is that anything you drink on an empty stomach passes through your kidneys in less than an hour. That means that if that liquid contains anti-lithic ingredients, they're going to start working in less than an hour. Now, will that dissolve a large stone in that short a time? Absolutely not. But it is more than enough time to dissolve small gravel that is causing fluid to back up in the kidneys, which is causing that sense of pressure that is so uncomfortable. And although it's not enough time to fully dissolve a large stone, it is enough time to dissolve the small points and sharp edges on that stone that are causing so much of the pain. So the bottom line is that yes, for many people, they can begin experiencing results in less than an hour. And as for the big stones, most will dissolve by the end of a 4-day detox. And we know that because people who have had scans and seen their stones in preparation for lithotripsy have then seen those stones turn to mush in their final scan just before the actual lithotripsy procedure, less than a week later, and after doing the kidney flush. And yes, the lithotripsy was then called off. Let me finish by reading to you from the very first testimonial I received for this formula. I'm going to condense it quite a bit because Patty included a tremendous amount of detail in her story that's very powerful, but not essential to the message in this video. Here is her experience. In 1989, at the age of 37, I began to have severe back pain, high fevers and nausea that would cause me to lie in bed for days. I curled up in bed, attempting to take deep breaths as sharp pains shot through my body and fevers made each muscle ache. I was shortly diagnosed with kidney sludge and a urinary tract infection, where doctors put me on Vicodin and antibiotics. Despite the pain medication, I continued to suffer from abdominal pain, stiff neck, lower back pain, spinal disc trouble, fluid retention, heel spurs, weight gain, fuzzy eyesight, and hair loss. One day in 1993, sharp pains caused me to rush to the hospital. I felt like I had knives stabbing me in my lower back over and over again, and the intense burning when trying to urinate haunted me every time I felt the urge to go to the bathroom. Desperate to try anything, doctors immediately performed surgery on me by placing a JJ stent, which is a tube that coils up in the kidney and urinary bladder to ease the passage of stones. Unfortunately, the stent only lasted a few weeks. I had so many stones that even the stent backed up, causing additional pain. Even worse, the doctors felt my condition was so severe that they denied me as a candidate for kidney or urinary transplant. They felt that the massive amounts of sludge would cause scar tissue and ruin my transplant within a year. In 1997, the pain was so intense that I ended up in the hospital again and was given liquid morphine once an hour, which is usually only used for cancer patients. They sent me home with morphine patches, Vicodin, fentanyl, and Cipro, and continued to tell me there was nothing more I could do. I continued to experiment with alternative solutions, natural healers, Reiki, massage treatments, you name it, but nothing made a difference. I moved home with my elderly parents, and we tried to help each other make it through each day. Nothing got much better except that I learned to cope with my situation with a positive attitude. Kidney and urinary infections continued every 2 to 3 months, and Cipro became my life mate, which would completely knock me out in bed for at least a week at a time. Doctors started to joke with me, saying I would glow in the dark for being on Cipro so long. That is until John Barron came along. I tried his new kidney formula on September 20th, 2007. Immediately, I liked the taste, especially when mixed with fresh-pressed apple juice, and told myself that this would be an easy formula to take for 7 days. Within 8 hours, I could tell something was happening in my kidneys. I had a little bit of nausea on the first day, but it went away by the second day. By the third day, all my kidney symptoms, back pain, abdominal pain, stiff neck, lower back pain, fluid retention, heel spurs, fuzzy eyesight, and painful urination completely dissipated. The most amazing part is that I had a release of major pressure in my lower back and right kidney, which is the first time I ever noticed even a slight release in over 10 years. When I went to the bathroom, I could actually urinate with ease, and I never had to strain. This is common because kidney sludge inhibits regular flow. I also had no burning. All of this was so shocking, I held my breath, hoping that this pain relief would continue. By the 4th day, I stopped taking my evening dose of pain medication and noticed for the first time in over 10 years, I had no pain. Patty wrote in a couple of months later to say, 2 months later, I can report holding strong, even after the 1 round of this formula. I still do not have need for my evening pain medication. My urine flow has remained normal, pressure in my lower back has never returned, and my energy levels continue to climb. In the end, Patty ended up using a bottle once every 2 to 3 months for maintenance and to make sure the sludge never built up again. Obviously, Patty is an extreme case, but it should be clear that for anyone already suffering from painful kidney stones, this formula can be a godsend. Whereas medical doctors can offer only surgery or expensive lithotripsy procedures, which are also not without risk, this formula offers a safe, highly effective alternative that can work with remarkable speed Does it work for everyone? Of course not. Nothing does. But it does seem to work for better than 80% of the people who use it. And it's not just people with kidney stones that should use this formula. The bottom line is that since everyone accumulates sludge in their kidneys, it's just a question of how fast, everyone is a candidate for regular use of this formula. Regular softening and flushing of stones and gravel will keep your kidneys and liver and gallbladder functioning at optimum levels and, more importantly, keep areas of those organs from choking to death and becoming non-functional. The sooner you start in life, the better. But certainly the older you get, the more mandatory regular use becomes. For most people, doing this program twice a year should be enough to keep the kidneys functioning properly. An ideal time to do this program is shortly before doing a liver cleanse. Using this formula just before doing the liver cleanse will greatly reduce the likelihood of discomfort while cleansing. As we've discussed, the same herbs that soften kidney stones for easy passage also soften gallstones. It's a win-win.